Hello everyone, my name is Nancy Bhaskar, and the focus of this presentation will be about the relationship between poverty and obesity within the United States. Obesity is a major public health concern because this condition can lead to the increased risk of developing serious chronic diseases such as cardiovascular disease, stroke, type 2 diabetes, high cholesterol, hypertension, and certain types of cancer. In fact, obesity affects more than one-third or 36.5% of US adults. While poor dietary habits and physical inactivity are some of the obvious causes of obesity, poverty is an important underlying factor that significantly influences the rate of obesity within the population. Poverty can basically be defined as the inability to attain a minimum standard of living or the inability to satisfy one's basic needs. Poverty is just one example of social determinants of health, which are the conditions in which people live and grow that can potentially affect their health outcomes and quality of life. Poverty is often characterized by factors such as low household income, unemployment, and the food insecurity. To begin with, I would like to present some relevant data on the issue of obesity. This data is taken from the 2015 Behavioral Risk Factor Surveillance System on the Centers for Disease Control and Prevention website. It includes information on adults' diet, physical activity, and weight status by state. The data is used for the data, trends, and map database for CDC's Division of Nutrition, Physical Activity, and Obesity. It provides information about the health status and behaviors of Americans and encourages proper nutrition, regular physical activity, and obesity prevention. On a national level, 28.9% of adults aged 18 years or older had obesity. In terms of nutrition, 40.2% of adults report eating fruits less than one time daily, and 22.1% of adults report eating vegetables less than one time daily. Apart from that, 25.9% of adults engage in no leisure time physical activity. The data on poverty is taken from the American Community Survey on the United States Census Bureau website. The goal of the American Community Survey is to help local officials, community leaders, and businesses understand the changes taking place within their communities and plan for future. The dataset features selected economic characteristics by state between the years 2014 and 2015. The data revealed that the median household income in the US in 2015 was $55,000. Furthermore, 6.3% of people were unemployed and 12.8% of households received food stamp and NSAP benefits. While analyzing the data by state, there were some interesting findings regarding obesity and poverty. In the year of 2015, the states with the highest percent of adults aged 18 years and older who had obesity are Alabama, Arkansas, Kansas, Kentucky, Louisiana, Mississippi, Oklahoma, Tennessee, and West Virginia. These states had obesity rates that were more than 33%. On the other hand, the states with lowest median household income are Alabama, Arkansas, Mississippi, and West Virginia. These states had household incomes below $45,000, which is lower than the national average. Based on this analysis, we can already see some overlap between the rates of poverty and prevalence of adult obesity in US states. This data explains why higher rates of obesity are often linked to poverty. Based on the data analysis, we can clearly understand the effect of poverty on obesity, especially in terms of nutrition behaviors and physical activity. In general, poor neighborhoods have limited resources such as the availability of affordable and healthy food options. Due to the high cost of healthy food, people tend to eat less fruits and vegetables and more inexpensive high-calorie foods that contain refined grain, added sugar, and saturated fat. Poverty also plays a major role in shaping up the built environment or the physical surrounding in which people live and work on a day-to-day basis. Poor neighborhoods often have safety concerns such as dangerous traffic conditions, lack of sidewalks, and limited street lighting at night. Moreover, there is a low availability, accessibility, affordability, and quality of public recreational facilities within poor neighborhoods. These factors prevent individuals from engaging in exercise and physical activity and practicing healthy behaviors in their daily lives. Now that we have gained proper insight about the relationship between obesity and poverty, it is essential to identify the key stakeholders associated with this healthcare issue. In particular, obesity involves stakeholders within the private sector, the healthcare sector, local, state, and national government, non-governmental organizations, as well as international organizations. The use of an influence diagram will be beneficial in visualizing the stakeholders and their relationships to one another. This influence diagram depicts the various stakeholders and how they affect our target population of adults with obesity in the United States. This is shown using the black arrows. The private sector consists of the car and transport industry, media and communication industry, entertainment industry, and food and beverage industry. The healthcare sector is comprised of medical and mental health care providers, emergency medical services, health advocacy, and fitness groups, and area health education centers. The local, state, and the national government includes regulators and policymakers, public health departments, police departments, and parks and recreation departments. Non-governmental organizations refer to community organization, academic institution, and education programs and groups. International organizations like the World Health Organization are also involved in this healthcare issue. The relationships between these stakeholders are shown using blue arrows. Starting off with the government regulators and policymakers play a major role in determining what kind of information is put out by the media and the entertainment industry. In some cases, mass media can also be used to impact health policy making. Besides media regulation, the government, along with the FDA and USDA, comes up with food safety regulations to meet the needs of the public. The media and food industry are also influenced by one another because advertising and marketing strategies tend to promote unhealthy food options towards the target population. Furthermore, public health departments often work together with healthcare providers to deliver high-quality services to the public. In addition, police departments work to keep parks and recreational facilities safe and encourage physical activity. Finally, non-governmental community organizations work in a combination with international organizations to provide education and increase awareness among the public about obesity and its other health consequences. The dissemination of information about obesity and poverty can be accomplished through a variety of different means, including social media, websites, blogs, press release. Individuals can also easily access such information in the form of flyers, brochures, pamphlets at local health clinics. Findings can be published in national journals, statewide publications, or local newspapers. Paid advertising, print media, billboards, and public service announcements could also be used in order to reach out to the public. Another great way to disseminate information is through the use of infographics. This infographic summarizes the information that we have discussed about the relationship between obesity and poverty in the United States. Unlike papers and articles, infographics are visually appealing and effective in drawing attention of the target audience. Overall, I believe that collaboration among all of the stakeholders involved and implementation of the proposed strategies will enable us to combat the obesity epidemic and lead to a healthier communities. I look forward to hearing your thoughts and feedback. Thank you for your time.